As a parent, I can only imagine the amount of stress and guilt they feel when they learn that their child has a developmental delay. It is our responsibility as early childhood special educators to identify risk factors in our students and to discuss them with other professionals in education. The earlier the child gets services, the better. This is known as early intervention. There are many benefits to early intervention. The first one being that early intervention maximizes the child's play-based learning opportunities. Especially during the first 3 years of life, purposeful play is a child's work and is crucial to brain development. It's critical to receive support for the child as soon as possible and to learn exactly how agencies might help if the child seems to be having developmental delays. Playtime with a caregiver or early intervention professional can help children develop the problem solving, self control, socializing, and communication skills they need. The second is that early intervention could reduce a child's requirement for specialized instructional help throughout their school years. Most children can benefit from early intervention by making progress towards reaching developmental goals that are suitable for their age. Children who get early intervention help may have improved peer interaction skills and a greater preparation for school. The third is that early intervention takes place in the child's most familiar environment and integrates it into their daily routine. Educational professionals can interact with the family in a setting that is familiar to them, such as in their home. Since children feel most at ease in familiar settings, early intervention activities should become a regular part of their day. By using techniques often and incorporating them into mealtimes, playtimes, and bedtimes, your child will advance. The fact that early intervention services are offered to families at no cost is the fourth advantage. It is well known that early intervention is beneficial in treating developmental delays. As a result of the money that is available, families can get early intervention services at no cost. Lastly, early intervention gives parents the tools they need to help their child realize their full potential. You are your child's first teacher as a parent. By using early intervention programs, you will be equipped with the essential resources to assist your child in overcoming developmental obstacles and realizing their full potential. Not only is early intervention beneficial for children, but as well for their family. Speech and language delays are among the most frequent developmental delays that young children experience. When developmental issues arise in young children, delays in language and communication development are frequently the first indicator. The first benefit of early intervention for families is that it offers them information, resources, and support. Early intervention gives parents the tools, encouragement, and knowledge that they need to improve their child's communication abilities. Parents might feel secure in their ability to support their child's communicative development when they collaborate with an early childhood educator. The second benefit is that it could create stronger relationships between the family and peers. Delays in language and communication can also affect how well children comprehend and interact with one another. It is challenging to learn how to resolve disagreements, form relationships, and solve difficulties as a result. Early intervention helps children develop their language skills so they can communicate with peers, express themselves, and pass on messages. The ability to improve behavior at home and school is the third advantage. Children who have delays in their communication development can get frustrated and display difficult behaviors as a way to make up for these delays. When speech is restricted, it can be challenging to communicate needs and wants. As a result, physical responses like biting and hitting frequently takes place of speaking. Support and techniques for facilitating your child's communication needs will be provided through early intervention. Depending on your child's specific developmental delay, early intervention strategies may look different than these, but overall are still beneficial. As I previously stated, the benefits that early intervention provides for families, it also is critical to collaborate with families when addressing risk factors in early intervention strategies. When it comes to discussing risk factors, not only do you want to identify the child's, but possibly the parents as well. Multiple parent or caregiver characteristics that may be linked to developmental delays or even learning disabilities have been found in research. These include misuse of drugs, unresolved mental health conditions, young parenthood, a lack of schooling, and an inability to form an emotional connection or provide for the child, a history of abuse or other trauma. But when it comes to the child's risk factors, you can gain some insight on what the parents may be observing at home. Excuse me. Typically, children tend to be shy at school and be their true selves at home. in order to learn about the child's individual strengths, needs, and ways to support their development through naturally occurring learning opportunities. Families actively participate in early intervention as members of the child's team, alongside a service coordinator and other early intervention professionals. A child's growth with the assistance and instruction of certified early intervention service providers depends on the active involvement of the family and caregivers in the early intervention process. This is why the collaboration of families is critical when it comes to discussing early intervention strategies. When it comes to obstacles, a child's education and development depends heavily on early intervention and family engagement. However, this procedure may be complicated by a number of obstacles. The following are some typical obstacles and possible resolutions. The first obstacle being the lack of awareness. It's possible that many families are unaware of the value of early intervention or the existence of these services. One possible solution may be to raise awareness through educational material distribution, instructional training sessions, and community outreach activities. The second obstacle can be cultural and language barriers. Effective communication and teamwork might be affected by language and cultural obstacles. A possible solution may be to recruit employees who offer language translation services. Establishing rapport and trust requires acknowledging and valuing cultural differences. The third obstacle can be time restrictions. Enrolling in early intervention programs may be challenging for families with busy schedules. Early intervention can provide services in a range of locations, including at home, and give flexible scheduling options. Lastly, stigma and fear is another obstacle. Some families can be unaware of the child's needs or fear stigma. As a solution, we can offer therapy and emotional support. We can also inform families of the advantages of early intervention while eliminating any misconceptions they may have. Keep in mind that overcoming these challenges calls for patience, understanding, and a dedication to collaborating with families in the child's best interest. One key aspect to take away from this is that earlier is better. Thank you.